Cannabis use disorder triples oral cancer risk. New study explained. Imagine being told that your daily habit of smoking cannabis could increase your risk of developing oral cancer by a staggering threefold. This alarming revelation is not just a warning, but a harsh reality that has been uncovered by a recent multicenter clinical cohort analysis published in Preventive Medicine Reports. The study's findings are a wake-up call for the millions of people who use cannabis regularly, highlighting the potential health risks associated with chronic or problematic use. But here's where it gets controversial. While many people believe that cannabis is a harmless substance, the evidence suggests that it may be more damaging than we think. According to study author Raphael Cuomo, Ph.D., associate professor in the Department of Anesthesiology at UC San Diego School of Medicine, cannabis smoke contains many of the same carcinogenic compounds found in tobacco smoke, which have known damaging effects on the epithelial tissue that lines the mouth. This is a critical point, as it suggests that the risks associated with cannabis use may be more similar to those of tobacco use than we previously thought. And this is the part most people miss. The fact that cannabis use disorder, which affects up to 3 in 10 users, may be a significant contributor to the development of oral cancer. To understand the relationship between cannabis use disorder and oral cancer, Dr. Cuomo conducted a retrospective cohort analysis of clinical records from the University of California Health Data Warehouse. The study included 45,129 eligible adults who were screened for drug use disorders between January 2012 and December 2019, without a prior oral cancer diagnosis. The results were striking. A total of 949 patients, 2.1%, developed cannabis use disorder, and 0.7% of those patients developed oral cancer, compared to 0.2% in the non-cannabis use disorder group. The unadjusted odds ratio for developing oral cancer with cannabis use disorder was 3.24, and after adjustments for smoking status and other factors were made, the odds ratio was 3.25. But what's even more alarming is that in the case of tobacco smokers with cannabis use disorder, the odds ratio for developing oral cancer within 5 years was a staggering 6.2. So, what does this mean for cannabis users? Dr. Cuomo suggests that the immune-suppressing effects of tetrahydrocannabinol in cannabis could be contributing to the increased cancer risk. This is a critical point, as it highlights the need to assess long-term oncologic risks of problematic cannabis use. As the availability and acceptance of cannabis use continue to grow, both federally and socially, it's essential to understand the potential health risks associated with it. With approximately 17.7 million people reporting daily or near-daily cannabis use in 2022, the need for further research into the effects of cannabis use disorder on oral cancer risk has never been more pressing. But here's the question. Do you think the benefits of cannabis use outweigh the potential risks? Or do you believe that the risks associated with cannabis use are too great to ignore? We want to hear from you. Share your thoughts in the comments below. And remember, while cannabis may be legal in many places, it's essential to be aware of the potential health risks associated with its use. As Dr. Cuomo concludes, these findings highlight the need to assess long-term oncologic risks of problematic cannabis use. It's time to take a closer look at the effects of cannabis use on our health and to consider the potential consequences of our actions. The content in this post has not been reviewed by the American Society of Clinical Oncology Incorporated, ASCO, and does not necessarily reflect the ideas and opinions of ASCO. For full disclosures of the study authors, visit ScienceDirect.com. Cannabis use and colon cancer, alarming link to increased mortality. Shockingly, a recent study has found that colon cancer patients with a history of cannabis use are 25 times more likely to die within 5 years of diagnosis compared to non-users. This alarming discovery, published in the Annals of Epidemiology, highlights the urgent need for healthcare professionals to screen for cannabis use disorders in colon cancer patients. The study revealed that the 5-year mortality rate for patients with a history of cannabis use disorder is a staggering 55.88%, while it's only 5. More research is needed to fully understand these interactions and how they affect patient survival. But here's where it gets controversial. Should doctors actively screen for cannabis use in colon cancer patients, or is this an invasion of privacy? And this is the part most people miss. The study doesn't prove that cannabis directly causes increased mortality, only that there's a link between the two. What do you think? Let us know in the comments below.